So
yeah, pharmacy benefit managers are, like you said, middlemen, but they manage the formulary. And some people think they're only in the private market, but almost all entitlement programs, that's Medicare and Medicaid, are now having their formularies managed by PBMs as well. So PBMs are getting a blank check from our tax dollars in Medicare, Medicaid, and of course all the private markets to manage formularies. So what they do is they choose which medication will be placed at a different level on the formulary. And a higher level on the formulary requires more money for the patient, so a higher copay, more money out of pocket, less, preferred, we'll say. And then another medication that's more favored or a lower copay, lower tier, has a lower out-of-pocket cost. So they essentially, for fees, for kickbacks, they will place preferentially drugs on the formulary. So they are gatekeepers of market access, and they're very consolidated. So PBMs, this is the problem. There's 3 of them. That's Express Scripts, CVS Caremark, and Optum, and they control 90% of every pharmaceutical transaction in this country.
Okay,
and
so these guys, the whole purpose of them existing was supposed to help manage the costs and to bring those costs down. And in a competitive market, but there are only really 3 main players, so that competition is limited. There are not a lot of choices in that market.
So anytime you have a monopoly, or in this case, an oligopoly of 3, which forms a monopoly, you're not going to have true competition. The other problem is that they receive their money on the basis of contracts which are allowed to be kept secret. According to
Yikes.
So according to a Safe Harbor Act, which is from 2003, which not incidentally was when prescription drug prices have
skyrocketed.
Increase, they are able to keep secret the money that they make. And so they take a percentage of the list price. So what this does is like a realtor. If they're going to sell you a property, they do take a percentage of the list price. They have more incentive to sell you a more expensive home. Same thing with someone who sells you a car. So that's not really serving the purposes of the patient or lowering prices. I mean, to be fair, that's a perverse incentive that is by law given to them. So I feel that transparency, and I know President Trump and their current administration believes that transparency is truly the key to try to unravel some of these perverse incentives that have caused increased prices. And that's both with pharmaceutical companies and prescriptions, and also hospital costs and insurance, and basically all healthcare costs. So that's one of the key tenets of the plan, is transparency for Trump's healthcare plan, by the way.
So kind of wrapping up this issue with the pharmaceutical benefits manager, you mentioned kickbacks, and so most federal law, I think if not all of it, prohibits kickbacks. But you mentioned Safe Harbor, and when this Safe Harbor rule passed, the Safe Harbor was to allow and not criminalize kickbacks. So how is it that we've said that's okay?
It's a good question. I don't understand it, and I've asked every lawmaker that I come in contact with in Washington, D.C., and the basic answer I get is that, well, campaigns are expensive.